Right, so this isn't going to be about communication skills training. Skills on their own quite often aren't enough. So if we take something like assertiveness training as an example, that is a form of communication skills training, and it's one that comes up quite often actually in people's therapy journeys. But what I find is that quite often there's lots of opportunity for people to practice the skill, as in they find themselves in situations in their lives where it would be helpful. But the reality is they don't get a chance to try the skill or to use the skill. And it's not because they've forgotten how to do it or they don't know what they are doing. It's more because of the internal stuff that shows up for them in that moment, like anxiety or guilt. So it's not a lack of skill. It's a lack of capability to carry out that skill when stuff is coming up for them and they feel bad. So good skills are really helpful. They are required. If there is a skills deficit, then that can be worked on. But alone, they're probably not enough. Think about some difficult conversation situations that you have been in, and then think about why you found that difficult. So I'll just give you a few seconds to think of something. Pause the video if you want to, and then come back. So there's some common answers here. Things that people often come up with are dealing with people who are angry, having to deliver some bad news to someone, telling someone that a mistake has been made, whether it's a mistake that someone else has made that's impacted them or a mistake that you've made yourself. Perhaps you work in a work environment where you have to challenge or call out a colleague about inappropriate behavior. Maybe you're a manager with a team and you need to raise a performance issue with another member of staff. So there's loads of reasons why you might need to have a difficult conversation with someone. So if we think about that these conversations are likely to come up at some point, what are the benefits of doing that well? What are the benefits of having that conversation? Well, a lot of the research around this area comes from healthcare situations. It comes from contexts where people are receiving difficult news and someone has to give that difficult news. So we're talking about things like palliative care environments. We're talking about cancer wards. That's where a lot of the research has been done. I don't know why that's the case. That just seems to be where a lot of the research is focused on. So if you're having this conversation with, say, a patient, what we find is when the conversation is done well, patients feel more informed. They feel like they understand better about what's going on for them. And therefore, they can give informed consent when things might need to happen. People can decision make with more information, and they can make a more informed decision about their care. People feel more respected, they feel heard, and they feel listened to, and that's really important. If it's not a patient you're talking to and it's a colleague, say, then it can help to improve better working relationships. It can help you become more informed and your colleague become more informed, because quite often we only have part of the picture and the story about perhaps what the conversation is going to be about. You know how you kind of build it up in your head and you tell these stories in your head about what might be going on, but then you receive some information from someone else and it changes everything. So it really helps you to get their perspective as well. So that's a benefit. But what are the costs of either not having this conversation or avoiding it in some way, or perhaps doing it badly in some way? Well, the literature suggests that in clinical settings, this can actually cause psychological distress. It can cause poor adherence to treatment. It can reduce the quality of life. It can lead to dissatisfaction with their care. It can lead to complaints. It can lead to potential burnout in healthcare professionals. I mean, it's one reason that healthcare professionals report burnout is the fact that they don't feel like they have the ability to have these difficult conversations with other people, and then they get really anxious about it. Well, think back to the example that you thought of at the beginning of this video where you've had to have one recently, And let's just think about your experience a little bit. So when faced with that tough conversation, what did you notice? Did you notice any thoughts that were going on through your mind? What if this conversation goes badly? I'm not good enough to be able to handle this conversation with this person. I'm not the right person to be having this conversation in the first place. I need to have this conversation really quickly because I've got loads of other things that I need to do. I hope I don't upset this person in this conversation, because if they're upset, I don't know how I'm going to handle that. Maybe emotions came up for you. Maybe you felt anxious. Maybe you felt guilty. Maybe you felt sad. Did you notice any physical sensations? Maybe a dry mouth, maybe shaking hands or a racing heartbeat? Did you notice any urges that came up for you? That desire to avoid, to escape, or to an urge to sit there and say nothing and almost like curl up into a ball? Again, to kind of distance yourself from the reality of having this conversation. All of those reactions are natural. They reflect how important this conversation actually is for you. Because if you didn't care about the conversation, then you wouldn't feel that way. I know you're doing this by yourself right now and thinking about this by yourself. But if we were in a group, I can tell you there would be loads of commonalities between people's experiences here. So the commonalities would be the presence of difficult thoughts coming up, the presence of strong emotions, some physical discomfort in your body, and an urge to run away or to try and escape from the conversation. This is natural. So this discomfort that comes up in whatever form it takes, whether that's thoughts in your mind, whether it's emotions, whether it's physical sensations, whether it's urges, that in itself isn't the biggest problem. What tends to happen is we move toward things that we want, that are nice, that are comfortable, that will give us pleasure, and things that are appetitive. And we move away from things that are dangerous to us, the things that might cause us harm or might cause us pain. We move away from things that are aversive, and that includes things that cause internal pain. So we move away from unwanted feelings and difficult thoughts. This is what causes the problem. This is the problematic part. So when you have a difficult conversation coming up, and we know from what we've just said, common to that are painful thoughts and feelings, then we have the tendency to move away from that and try and avoid it. We are designed, though, to experience the full range of human emotion. And I'm not going to get into the function behind each emotion. Maybe that's a video for another day, but they all do serve a function for us. Same as having difficult thoughts. That's quite natural. Our mind is there to look ahead for possible dangers, to try and problem solve, to remind us of things that have happened in the past so that we can learn from that experience, to notice important things that might be missing from our lives and to keep track of our place in the tribe so we can be aware of how other people are treating us. Now, all of those things have tremendous benefits, but at the same time, they bring with them pain and discomfort. So this instinct that we have makes us avoid difficult conversations because they bring up unwanted emotions and unpleasant thoughts. However, avoiding these feelings often creates more problems down the line, because if you give in to that urge to avoid or escape the conversation, you then don't have it. And then all of those benefits we talked about earlier don't happen. But someone at some point probably has to have that conversation. While unpleasant emotions and thoughts have important functions for us, they warn us of danger, they help us problem solve, they remind us about what matters. The key is to respond flexibly to them rather than letting them control our actions. It's not the experience of these things that causes us the biggest problem, it's how we respond to them. And this is where we see the role of psychological flexibility coming in. So if you're no stranger to the channel, we talk about acceptance and commitment therapy a lot here. And the purpose of acceptance and commitment therapy is to promote psychological flexibility. So psychological flexibility is the ability to move towards what matters to you, even in the presence of difficult experiences. So this all does sound really common to ACT, doesn't it? And remember, the T in ACT is therapy, acceptance and commitment therapy. But ACT isn't all about therapy. Being psychologically flexible isn't about needing therapy. It's equally applicable to day-to-day interactions that we have with other people when difficult stuff comes up for us. Sitting down with someone and informing them a loved one has passed away, or sitting down with someone and telling them they have a terminal illness, that's really difficult. It's supposed to be difficult. And we can apply all of the ACT processes that we learn about in ACT to those conversations. So one way we can frame this is looking at the 3 pillars of ACT. And the 3 pillars are open, aware, and engaged. So we have the pillar of being aware. This is being more present, both internally and externally. So internally, being aware where your mind is. Noticing if your mind is going off somewhere else. Notice if your mind is starting to worry, if it's starting to ruminate. Or maybe it's got distracted by something that's got nothing to do with this conversation. So noticing that. Also notice what's happening externally to you in the world in that moment. And that includes the person that you're talking to. How are they responding? How are they showing up? Can you attune perhaps to what they might be going through? Then we have the open pillar. Recognize why those difficult thoughts and feelings are showing up for you, because we care about this. It's not something to be fixed. It's not something to be avoided. It's something for us to try and make room for those difficult thoughts and feelings. Quite often people equate feeling bad to the thing being wrong. So if you're having a conversation with someone and you feel bad during it, then the conversation is going wrong, or it's the wrong conversation to be having. But quite often, that means it's the right conversation. It's the important conversation. It's the conversation you should be having. And then we have the pillar of engaged. This is the why. The why does this conversation need to take place? What is important about this conversation happening? How does it align with your values and what's important to you? And then be willing to experience the unpleasant thoughts and feelings, experience that discomfort, if that's what it takes for you to do something important and meaningful to you. So here's a question. Who matters to you? Just pick one person. I'm not asking you to pick your favorite. I'm not asking you to rate if you care about one person more than another person. It's not competition. Just pick someone. And how do you want to be towards them? What sort of person do you want to be? How do you want to show up for them? What usually comes up is things like, I want to be kind. I want to be respectful. I want to be caring. Okay, these are all values. These are ways that we want to be toward another person. And these are things that we can try to bring into our daily lives through actions. And when we do this, it normally gives us a sense of fulfillment. It gives us a sense of meaning. It gives us purpose. And notice I didn't say it brings us happiness, because that's a bit of a trap. You see my video, the happiness trap. It tends to lead to more this idea of fulfillment, feeling fulfilled. Remember we've talked about this pain in your values and values in your pain? That most things that are important to us are like 2 sides of a coin. One side being all the good stuff it brings, all the important and meaningful stuff. The other side bringing the pain that it also brings, and you can't separate the coin. So for example, if you have a value of caring, when you are unable to care for someone that you want to, or you hear about someone being uncared for, then it hurts you. It causes you pain because it's important to you. So how do we turn this into things that you can actually do? What steps can we take? Well, a great ACT trainer called Ray Owen has come up with 4 steps that might be helpful for you. And I'll put a link to Ray Owen's work in the description because he takes full credit for this. So this is his step-by-step approach that you can try, and it might help. So first of all, ground yourself in the moment. Start with a simple grounding exercise. There's loads of grounding exercises on my channel. Pick one of them. But if you want a very quick example, you can do something that involves your senses, like noticing something that you can see and describing it in detail. Notice one thing you can hear. Notice one thing that you can feel. And then take one purposeful breath. So in through the nose. Feel what that's like. Feel the sensation in your lungs, and out with your mouth. So a very mindful breath. Okay, this helps you bring your focus back to the present, back to the here and now, back to the, I'm going to have this conversation, and why is that important? That leads nicely onto step 2, which is set your intention. Ask yourself, what do I want to achieve in this conversation? Why am I having it? What's the purpose of it? Having a clear purpose helps you avoid getting sidetracked by discomfort that you might be feeling, or sidetracked by discomfort that might show up in the other person. Quite often I have to have a conversation with someone about ending therapy because for whatever reasons, we can't continue with our sessions. And that's a really difficult conversation to have. And it's really easy to get caught up in the emotional experience of that and the discomfort that I feel about having to have that ending conversation, and then potentially agreeing to continue having more sessions when the reality is that's not something that can happen. Having said that, there are times where maybe the circumstances have changed so much that something other than what you had planned has to happen. And that is why it's important to also be present in that conversation, to really attune to the person that you're talking to so you can respond flexibly within that. Step 3, connect with your values. Reflect on why this conversation matters and how you want to show up in it. So, for example, you might really connect with a value around caring for people or around honesty. So you might want to provide clear information to the other person so they feel respected and informed, so they can adequately make a decision about their care or about the next steps in this situation. And then the 4th step is engage your willingness. Identify the difficult thoughts and feelings you're experiencing them. Label them. Remember the cognitive diffusion exercises. Labeling your feelings, labeling your thoughts helps you get a little bit of distance from them so they don't control your whole behavior. Dan Siegel talks about name it to tame it. That's what we're doing here. I notice I'm feeling anxious. It can reduce the intensity a bit for you. Just take the sting out of it. And then ask, am I willing to have these feelings if it means doing something that's important to me? And try and stay flexible. Notice when your mind drifts into worry or it drifts into self-doubt. Gently bring your focus back to the conversation and stay open to adjusting your approach while keeping your goal in mind. So here's some final thoughts. Difficult conversations are challenging because they matter. If they didn't, you wouldn't feel the discomfort. By staying open, aware, and engaged, you can navigate these conversations with greater confidence, with greater integrity, if that's important to you, and more in line with how you want to be and show up in the world for other people. Remember, managing difficult conversations isn't about avoiding discomfort. It's about being willing to face it in service of what truly matters. So I hope this video was helpful. I appreciate it doesn't give you any skills in terms of the actual words to say for when you're having a difficult conversation, but maybe it gives you something to think about if you're thinking about avoiding it or escaping it, or if there's unpleasant and difficult emotions or thoughts, feelings showing up for you. That's it for this one today. Hopefully you took something away from it. Take care, everyone. Goodbye.